Hi, I'm Carolyn Finley, and this is my compliance presentation on the moral right to health care. The right to health care has become one of the biggest topics for debate. Everyone should have the right to health care if needed and in an equitable manner. The advancements in medical care have continually changed how healthcare providers interact with their patients. There have been continued improvements in the quality of care. Unfortunately, those advancements increase the cost and have not offered affordable, complete access for everyone. Cost containment. New technological resources in medical care have allowed individuals to live longer, healthier lives. These major improvements have shown that some services can become a product of fraud or abuse by a provider. Although medical practices may turn a blind eye to upholding the cost of services and salaries, the Affordable Health Care Act should offer some relief. Resources should be utilized for a better patient outcome, but efficiently and equitably, so as not to overuse technology services, especially when tied to financial gain. Patient safety and quality. The adoption of electronic health records can protect patients by improving their safety and quality of care. The ability to provide access to a patient's record anywhere across the country improves the chances that medical personnel will have any reference needed to assist in delivering the best care. Embracing the integration of an electronic health record system helps the provider reduce adverse effects of medications when a patient fails to mention a medication that may conflict with the doctor's recommendations. Medical malpractice. Medical practitioners can be the cause of medical errors in a number of ways, whether it's administrative, improper identification, or a medical dosage. These mistakes can be unsafe or fatal. Caregivers should take care to ensure their actions never put a patient at risk, and their handovers are critical. Privacy and confidentiality. The information a practitioner gathers concerning a patient's identity is considered protected health information, or PHI, under the Health Insurance Portability and Accountability Act, which is HIPAA. The HIPAA privacy rule provides protection for detailed health information on an individual and gives them an assortment of rights regarding that information. The privacy rule is sensible enough so that it permits the release of health information needed for a patient's care. Yet, there are times when the provider has to determine how the privacy rule interacts with state laws and regulations to maintain a patient's privacy. Informed consent. The goal of the informed consent is to provide an individual with sufficient information to make an informed choice on whatever treatment they're receiving. Ethically, it is an important process and should never be reduced to a patient simply signing a form. Resource allocation. Healthcare organizations serve as decision makers on what resources will be allocated to patients. Creating policies and procedures that provide effective leadership to distribute available resources that will ensure success and improved health outcomes. This can only be effective when appropriately allocating medical services and manpower. Medical workers are responsible for decisions regarding care, delivery of care, and patient outcome. Providing the proper training and feedback regarding allocations can offer healthcare workers a reassurance needed in the workplace. This is the end of my presentation. Thank you.